Okay, and you'd agree that a lot of these names that he was calling her was actually character assassination, wasn't it?
They were harsh names, yes.
And you wouldn't consider that to be okay?
No, that's not okay.
And in fact, that was abusive, wasn't it?
Abuse implies that it's a pattern of behavior. I would say that that behavior was certainly inappropriate and not a healthy communication style.
Okay, but you don't consider it abusive?
I would say, again, the word abuse implies a pattern of behavior.
Well, we can talk about patterns in a second,
Okay.
but I'm talking about the word abuse. So you mean that unless it's repeated, this one particular incident wouldn't be considered abusive to you?
If we define abuse as a misuse of something,
no, Dr.
just
DeMarte,
a misuse, yes.
Hold on a second. What I'm asking you is this one particular instant, on May 26th, let's say, when Mr. Alexander, as you've agreed, was calling her names consistent
Yes.
with character assassination. You wouldn't agree that that's abusive?
I'm trying to explain to you what I mean.
Well, I'm asking, you're telling me that abuse is a pattern, so if it's just one instant, then is that not abuse?
I'd like to clarify. Can I speak?
It's a yes or no question.
I don't believe I can answer in yes or no.
All right, so then that's a no.
No, I just said I can't answer you in yes or no.
All right, so then let's talk about patterns. You want to talk about patterns, and when we talk about abuse, you want to look for more than one instance of it, right? For you to characterize it as abuse?
I again would like to clarify that.
Do you want to see a pattern when you're looking at abuse?
I'd like to clarify that.
Clarify the fact that whether or not you want to look at a pattern?
What I've been trying to clarify.
I'm moving on, so I'm just asking the question, do you want to see a pattern when you're looking for abuse?
It depends on how the word abuse is used. That's what I'm trying to explain to you. If it's implied that there's a pattern, no. If you're talking about the word abuse as being a misuse of something in one instance, then you can use the word abuse in a single incident, yes.
Okay. Did you clarify enough?
I did, thank you.
All right, you're welcome. So, okay, and when you talk about this conversation on May 26th, if you know that he has called her these types of names before this, let's talk about May 10th, or if he's called her names on April 8th, or April 7th, or March 30th, don't we start to see a pattern?
Are you talking about a hypothetical?
No, I'm asking, you've read through the text messages, right?
I have.
And you know that he calls her names, right?
Very rarely, yes.
You think very rarely he calls her names?
Yes, I would say that.
Okay. And so, how do you define rare?
I would say that it happened periodically, the pattern that I saw, that it was in response to him feeling like she was being intrusive or had crossed a boundary, and he was putting up very firm boundaries.
That's not what I'm asking you. I'm talking about rare. So rare is once or twice or more.
Are you asking me in this situation how many times it happened, or just the definition of rare?
You said he rarely was abusive to her.
Yes.
So, and actually you said he rarely called her names. But are you going to use the word abusive with that, or just calling names?
Calling names. Okay. I would say that they were infrequent comments that were made.
No, you called it a pattern earlier. Are you taking that back?
I'm not taking anything back. You're changing my words.
No. Did you not just say pattern just a few minutes ago?
I said pattern in those specific exchanges, that there was a pattern within. You're talking about now a pattern across. That's a very different presentation.
No, I'm not talking about that. So let me make sure that you understand me, okay?
Please clarify.
So I'm talking about in a specific text message conversation. You read through all their text messages, didn't you?
I did.
Okay. And when you read through the text messages, did you see within, let's talk about just one conversation when he's upset with her?
Yes.
Just any particular one.
Okay.
Within that conversation, you see a pattern, don't you, of him calling her bad names again?
Within the text messages, yes.
Okay. So we have one that we know of from May 26th, right?
That's the date you gave me, yes.
Okay. And then you've seen another conversation when he is extremely calling her bad names, right?
Yes.
And you consider that to be another pattern within that conversation.
Are you now highlighting a third instance, or are you still talking about that second one? Yes.
Okay. And you had other communications, you reviewed other communications between them where there was a third time when he is calling her bad names, right?
I'd like to see that.
Do you not remember that?
I remember that there, again, were infrequent situations.
Well, I know you keep wanting to say infrequent, but you're not giving me any information as to that infrequency. what we're talking about here is specific conversations where you're telling me within this conversation there is a pattern of him calling her bad names and character assassination, right?
Objection, lack of foundation, date and time, conversation. Overruled.
What I'm saying to you is that in order to be accurate in how I respond, I'd like to see what you're referring to so that I'm not misleading in any kind of way.
Because you wouldn't want to be misleading, right?
Correct.
And you wouldn't want to add anything into your answers just to mislead people, right?
Right, I don't want to mislead anybody.
Okay, so we can agree then that you would want to just answer the questions as they're posed so that you don't give any misleading information.
Right.
Okay. You were asked questions about when Mr. Alexander made comments about being afraid of Miss Arias, right?
Yes.
And that you wouldn't want to go behind those words, right?
Right.
You wouldn't want to do any further investigation as to why he might say something like that, right?
I can't do that. He's not alive.
Right. But you wouldn't want to use any of your other data points to investigate why he might say that?
I would use this as an objective data point that I would then use in addition to everything else, putting it together. But I wouldn't alter the words. It's not possible to alter the words.
No, you wouldn't want to alter the words, but wouldn't you want to understand and put those words in context?
And would I look at it in context? Yes, I would look at it in context.
And you would want to look at then behaviors and investigate maybe whether or not there's any true meaning behind these words, right?
I couldn't do that because he's not alive.
So when somebody's not alive, you can't get any information from them. Is that what you mean?
From them directly? That's correct because they're not alive.
Will show the presence of the jury, the defendant, and all counsel. Ms. Wilmott, you may continue.
Thank you. Good afternoon, Dr. DeMarte. I wanted to clarify a few things with you. You said talking about Jody working in 10 different restaurants, right?
Yes.
You're aware that that was over a time of 15 years, right?
She indicated that I asked her how many restaurants she had worked in, and that was the number she gave me.
So you're aware that this was over 15 years?
My understanding is that she worked with her father up until around the age of 18. It may have been 17, and then after that it was 10 restaurants.
So you're aware that the 10 restaurants was during a time period of 15 years. Do you know this or not?
It wasn't over 15 years. It was over, that would have been 8 years. As I just indicated, she worked with her father until 18 or somewhere around there.
Okay, so you think it's just a period of 8 years?
Whatever, 18 until she was incarcerated, yes.
All right, okay. And so you're going to look at then information when you're trying to diagnose borderline, you're going to look at information that occurs after a traumatic event.
Yes,
right?
because personality is stable.
All right. And so even though the DSM tells you not to do that, right?
The DSM does not say not to do that.
Didn't you agree with me earlier that the DSM tells you that if you're looking at borderline personality, you need to look at a pattern from the beginning, and if there's a traumatic event, you want to make sure that this pattern is before the traumatic event, right?
No.
No, that's not what it says?
No.
So then you didn't agree with me before.
Restate your question so that I could be clear about what you're asking.
When you're talking about diagnosing borderline personality, okay? Don't you need to make sure that you're looking at a pattern throughout the person's life, right?
Yes, that's correct.
Okay. And if you're looking at a pattern throughout the person's life, when there is a trauma, when that person goes through a trauma, don't you want to make sure that the pattern exists before the trauma?
Yes.
Okay. You talked about her going from boyfriend and boyfriend and needing this, having this strong attachment, right?
Yes.
But you didn't talk about the fact that when she broke up with Mr. McCartney, she was single for 14 months before she even started dating Mr. Brewer, right?
That wasn't my understanding.
Oh, you didn't know that?
My understanding was that right after Matt, she was dating Daryl.
So you didn't clarify that with her then in your interview?
No, that's the information that I received.
Not from Miss Arias, though.
I can reference my notes if you'd like.
Sure. Do you have those with you, or do you need them?
Right here.
They were, okay.
Consistent with what I just said.
There's no question about the fact that Mr. Alexander had called Miss Arias names like whore, right?
Yes.
And he's called her names like slut.
Yes.
And just because he calls her these names, that doesn't make it true, right?
Doesn't make what true?
That doesn't make it true for him to call her this name. You wouldn't just accept the written word that it must be true then, right?
That what must be true?
That she's a whore? If he calls her a name, do you think that that means it's necessarily true?
If he calls her a name, that's just what he called her. That's what is true, that he called her that.
Okay. And you would consider that abusive, wouldn't you?
For going back to the word abuse, meaning the misuse of something, so it would be a misuse of words. So I would say in that situation, yes, it was a misuse of words.
Okay, so if somebody called someone you know or you love a whore or a slut, you would just tell them that's a misuse of words, right?
I'd say that's inappropriate.
Okay. And despite knowing that there is this name calling that's going on and escalating throughout the relationship, you would still not term this as a pattern of verbal abuse, right?
That's correct.
And you would make that opinion based on the fact, or despite the fact, that you are not a domestic violence expert.
I've worked with a lot of people who have experienced domestic violence.
But you told us yesterday that you are not a domestic violence expert, right?
I did based on the idea that I do not have a license in domestic violence.
What license is there in domestic violence?
That's exactly why I said that. There is no license in domestic violence. I told you that I'm a licensed clinical psychologist and I'm an expert as a clinical psychologist because my definition, expert is license.
You agree? Are we going to go back to this?
Sure.
The fact that you're saying that somebody needs to be licensed to be an expert in domestic violence?
No, I was asking you what your definition was and you didn't provide one for me. My definition would be licensure indicates someone has an expertise in that area, and that's
so
what I
anybody
define.
who doesn't have a license in something means that they're not an expert. Is that what you're telling me?
It depends on the definition.
Okay, so according to your depending on a definition now,
Yes.
you're taking it back that you think you are an expert in domestic violence? Is that where we're going?
Yes, I have a lot of experience in domestic violence.
Okay, so yesterday you were not an expert in domestic violence, but now today you are.
I just gave you an example of why I said that, or not an example, I gave you the reason why, that I was basing it on licensure status. I indicated that I have a license as a clinical psychologist.
So the fact that there is no license that a person can get to make them an expert in domestic violence, you would still say that somehow you're not an expert because you don't have this license that doesn't exist.
That's the criteria I was basing it on when you asked me that question.
Okay, so the fact that you don't have a license in domestic violence, a license that doesn't exist, that's why you're not an expert.
That's what I was basing it on.
Okay, so somehow if this magical license somehow appears and you are able to receive a license in domestic violence, then you can become an expert. Is that what you're telling us?
Based on the criteria that I was conceptualizing it, yes.
And as we speak right now, there is no such thing, right?
That's correct.
Can you tell us what A and G means?
Anchor.
Anger. And that is... Is that anything we need to know? Okay. All right, anger. And we see anger at average, right?
Yes.
Below clinically significant.
Yes.
And in fact, let's take a look at the anger subscales.
That would be an inappropriate use of the MMPI.
Well, let's take a look at them anyway. And again, with this scale, we're starting to see a pattern, aren't we, of anxiety, right, and low self-esteem?
No, I don't see that pattern. With low self-esteem?
Yeah, you've seen anxiety on more than one scale now, haven't you?
Anxiety, yes.
Okay, and now we've seen low ego strength, and we've seen the low self, right?
Which was low self-concept,
Yeah.
which is identity disturbance.
No, I'm talking about low self-concept having...
I explained earlier what that meant, what that means.
Mm-hmm. We talked about it meaning self-doubt and submissiveness, right? That's how these scales are subscaled.
If you look over to the T-score, you'll see that only self-doubt is elevated, not submissiveness.
Well, submissiveness is elevated above normal, right?
It's not interpretable. You're interpreting it improperly.
I'm not interpreting it. I'm telling you
You are
that
by
it's...
saying that.
I'm asking you the question.
Okay.
It's above normal, isn't it?
It's not above the clinical threshold.
I didn't ask you that. I asked you if it was above average.
It's above 50.
Yes, an average is 50, right?
Yes.
So it's above average.
Yes.
Okay. And so when we talk about low self-esteem, we're talking about self-doubt and submissiveness, right?
According to
Generally speaking, when we're talking about low self-esteem or low self-esteem subscales, we're talking about self-doubt and submissiveness.
Yes, and
Okay.
remember that the label doesn't go with the description. Self-doubt means a poor sense of self.
So when we look at these scales on the MMPI, what we're looking at is the fact that we've seen a high level of anxiety, right?
Yes.
And we've seen high levels of depression.
Yes.
And we've seen low self-esteem.
Yes.
And these are all symptomatic of PTSD, aren't they?
Those are some symptoms seen in PTSD amongst other disorders, yes.
So you see these symptoms in PTSD, don't you?
You can, yes.
You do, don't you?
You can.
So somebody with PTSD might not have these?
Correct, like depression, for example.
But they're going to have anxiety, aren't they?
Yes, that's correct.
Okay, so let's be specific.
Sure.
You see these things most often when you have a PTSD patient. You tend to see these things, don't you?
No, not all of them.
You don't see them. So
No.
you're telling me when you have a PTSD patient, you don't see anxiety.
Anxiety, yes.
All right, and so they're not always depressed?
That's correct.
Okay, and they don't always have low self-esteem?
That's correct.
According to you, right?
According to me.
All
Those
right.
are my patients that I've seen.
And we don't see any hostility on the scales, right? The over-controlled hostility, that was low, wasn't it?
Can I interpret what that means?
No, I'm asking you that you saw it on the scale and
You're
it was low,
misinterpreting
right?
it, yes.
And we saw that it was also low on aggression, right?
Which scale?
On the last one that we just looked at.
The ones that I don't interpret. I can't give an interpretation on that.
The ones that you don't know about, is that what you mean?
No, the ones that are empirically validated enough to use.
Okay, so the ones that you choose not to use, right?
That's standard.
You're aware that other psychologists use these scales, right?
Most psychologists follow the standard that I do. It's common practice.
Okay, you think most psychologists don't use these scales, is that what you're saying?
Yes.
Okay, nevertheless, just humor me for a second. You saw aggression, right? And you saw that it was below the clinical significance, right?
I did see that.
And you also saw that dominance was also below the clinical scale
I did.
and below normal, right?
Yes.
And having low hostility, low aggression, and no dominance, those are also characteristics of a battered woman, aren't they?
Not necessarily.
So in your experience, you don't see that in battered women?
Not necessarily.
And in your experience with trauma, you see these in trauma, don't you?
What aspects specifically?
Trauma victims?
What aspects specifically?
Having low hostility and low aggression?
Have I seen that in trauma victims?
Yes.
I've seen it in some and not in others.
And you've seen that these are also characteristics of PTSD, right?
Sometimes it can be, yes.
Again, sometimes. So these characteristics you have seen in your practice associated with PTSD, is that right?
Which ones in particular? You just
The
listed off
same
several.
ones that I'm talking about. No hostility, no aggression, no dominance.
Do I see that in trauma victims?
No, PTSD I'm talking
In
about.
PTSD?
Yes.
Do I see no aggression in PTSD?
Do you tend to see people with low aggression?
You're talking about characteristics that are not directly associated with the disorder. You're going back to differences in people. Everybody is different. One person with PTSD may look different than someone else with PTSD.
Well, if everybody's different, then why would we bother using any of these scales at all?
Because those aren't specific to PTSD. The MMPI is specific to personality characteristics in general psychopathology, not
Right.
specific to PTSD.
So when we're looking at personality, concepts of personality, what we just went through is the fact that Jody's concepts of personality, we see a we see low hostility, don't we? On these scales that you administered.
Yes.
And we see low dominance, right?
Yes.
And low dominance means passiveness, doesn't it?
I would have to look at exactly how the MMPI defines it. Would you like me to do that?
No. Dominance. Dominance means that you dominate over somebody. Can you agree with that?
Yes.
Okay. And when you are not dominant, the opposite is passive, right?
You're again making the assumption that the name of the scale is exactly what it measures, and that's not always the case on the MMPI.
And you don't know, right?
I'd be happy to look at it. She didn't elevate on that scale.
She did not.
Right, so that's not something that I interpreted.
Right. So in other words, you only looked at her elevated scales.
That's what's clinically significant. Yes.
Okay. So the fact that she was not elevated in things like aggression and dominance and hostility, that was not important to you.
Research doesn't support low elevations.
I'm asking you a question, Dr. DeMarte. I just want you to answer the question.
Okay, can you ask that again, please?
Yes. The fact that she was low in hostility, low in aggression, and low in dominance, that was not important to you. Is that what you're saying? You didn't interpret it, right?
I did not interpret it.
Okay. Thank you. Nothing further. And submissiveness, right? Submissiveness.